Hello, everybody. Welcome to another episode of Grace Over Grit and Growth. We are the podcast where we're helping women embrace who they are gracefully while being unapologetic.
And I am Monique Fisher.
I'm Alita Anderson.
And welcome to our second part of our Women's Health Symposium, if you will. And we are here with our two RNs, Rhonda Abdulah and Pat Meade.
Yes.
And we are going to continue. As you know, this is our live show and we have an audience. And so we actually went out and talked to the audience during the break. And we have some questions for you all. And so they want to open it up talking about the big M word, menopause. And so we did get some questions about menopause in terms of what are their symptoms. And somebody specifically wants to know, is weight gain a byproduct of menopause, or is it just we should be eating better, or what, you know?
I don't know if it's the weight gain, it's the redistribution of the weight.
Oh.
Because you can maintain your weight, but it's just now it's not distributed the way we want it to be.
Okay.
So that, to me, that would be the
So it's
problem.
right here in the middle.
Yep.
Yeah.
I used to have a waistline.
Yeah. I don't know if I can say that, but okay.
I remember when I went into menopause because I had a tumor at a young age. And so when I woke up from surgery, I was immediately in menopause. And I was like, what is this? And I was in my 20s. So you're so uncomfortable. You just don't know where and how much and where. Everything is just not right. But I look at menopause now as I see it in my age now, and it's like, job well done. Okay, you're moving like you should. It's not a bad thing to have. It's something you're going to have. We do see that we're seeing it in younger ages. There is some documentation that even talks about 20s and 30s. But yes, with the weight and the headaches and the sweating in the top of your head, and all those are just symptoms of your body changing and adapting to like loss of hormones and things like that. So then you need to go, see your physician as always, because they do have treatment modalities that you can utilize. They may help, may not, but they certainly may ease some of those symptoms. But can we get around those symptoms? No, but we can just wait to make it easier and more easy to deal with and accept, because it's not a wonderful thing.
So we're seeing medications like to deal with the night sweats and that type of thing. Do you think those are good things that we should take to kind of ease that, or should things a little bit more natural, like what was it, black cohosh? They told us black cohosh, take that, or
Red raspberry tea.
Yes.
Tried them.
Nah. No.
But I think just knowing, I think if we just knew what to expect, that would be half the battle. Hot flashes, I think that's the number one thing that most people experience. But the hot flashes, I think if you learn what triggers them, because some foods do trigger them. I know if I have my cup of coffee in the morning, which I'm going to have every morning, I'm going to have a hot flash in about a half an hour. And does it stop? Does menopause, you start menopause, when does it end? Because mine has been going on for quite a number of years now. And so I don't know if there's an end to it. It's just learning how to deal with the circumstances and the discomfort. Mood swings, sometimes that can be a plus because that gets people to leave you alone. And so you have to look at how you handle it, what's going on and how you handle it. I mean, you can't kill your whole family, even though there are times that you may want to, but it's justifiable sometimes. You feel it and you just have to learn how to work through it.
I actually work with nurses that actually have a fan at their stand,
Mm-hmm.
and it's like on the whole time, and they're just sweating. And I'm cold all the time, so I just like, okay, but I've been there, so I understand. I've actually at times put my head in the refrigerator. In the freezer. That is how that's how it is. It's just overwhelming, and I think it's so it consumes you. You can be absolutely fine, and then you blink and you just drenched, and okay, that's what I have. But that's like it's like the first place it wants to go, and you just feel bad, just generally bad. There are medications. There are medications. I don't advocate any kind of medication without talking to your physician. And then sometimes you don't want to take a medication that might precipitate something else.
Mm-hmm.
We don't want to do like hormones that may, at our age, we don't want that to maybe precipitate something graver, which it can,
because
just to be realistic.
Hormone therapy used to get such a bad rap. It was like you don't want to take an estrogen or progesterone or
Especially
any
if
of that
you've got a
because
history of cancer.
Yeah,
If you've
and
got
if
a
it's
history of
estrogen-based
so
cancer, then that's why you have to.
okay.
So sometimes we just have to muddle through. We've been through so much. It's just you treat the symptoms, how you're feeling at that moment. That is the safest way. I was looking at the literature, and menopause can last up to 10 years. That was a 2025 that I read this morning. Yes. So
Yeah.
but most of the time it's different with everyone, though.
Is there a difference? I'm sorry, between perimenopause and menopause?
Yeah, perimenopause is just your estrogen level is decreasing.
Okay.
So it's decreasing to the point that you're not producing as much estrogen, so therefore your body is starting to go through the phases. So you may experience that mood swing. You may experience that hot flash and not know why. So.
Okay.
I was just going to ask it seems like times it just comes on as an onset. You said 10 years is possibly for how long it could last. How do you know when it's over? You just know? Or was there something that happened?
You feel wonderful. You do. You can tell. It's like, I don't have a hot flash. I haven't had a hot flash in like a month. What is this? And you don't have all the symptoms will just dissipate. And they're not all at once. They're going to gradually just kind of fade away. You might have a little residual hanging around, but the fact that it's just something that we have to just muster through. But when they're going because it's like a hallelujah moment, and everyone is like really excited about that. And your sisters will be giving you a high five and all that. Yeah. But again, I just like to look at it as like, ladies, well done. Look what you've done. Because now you're at a phase you've risen, you had your families. Look at that. All that took all that estrogen and all that to do that. And your just overall growth and protection of your body. You have to look at yourself holistically. And so as your body is like going to the next phase, then that's just part of it. The one thing we do want is that you ease into it gracefully. That would be ideal. But the fact that it will go away might take you a bit, but just I look at it as what we've been through and why we're going through it now. Because look at my nieces, my nephews, your grandparents, your grandchildren, and that it's all like the residual of the discomfort that you're feeling right now, and those are the good things. So.
I think the shocker of it is that it's not talked about. So you wake up like, what is going on? Like, why am I mad? Why am I this? What's going on? And it's almost like I remember when I was pregnant with my first child, and they had that book, What to Expect When You're Expecting. So you're like, let me see, is this normal? It's normal. I feel like we need a book, because there's so many different things, and it's just like the unspoken. So those conversations start to happen within friend groups and within, not necessarily you're trying things out when there's things that have been gone. And it's just odd because, like you said, it's a natural part of life. But it just doesn't seem like there's that place where we're getting our questions answered.
So we're not. And I think historically, because our grandparents never talked about us, grandma never said about this. She just lived through it and just said, okay. And we don't, even when you talk to your physician, he's like, it'll be all right.
Right.
Here we can give you, patch, you can do this, whatever. It's kind of like you're going to be okay.
Yeah.
100%. And you kind of feel that way if you talk to your physicians. It's not that they don't care, but it's just like, this is normal. Nothing's abnormal. They're going to tell you that as well. No, you're fine. Everything's good. And you want to hear that. But there really was not a conversation.
Right.
You know, as we grow older, what happens to you? And that's kind of how healthcare is as we grow old in any phase. You know, you either like are treatable, or we're going to start, you know, these people over here, and we got these right here. And that's kind of how we're looking at things with healthcare now, especially when they start thinking of, and it's normal. When they start to make it's normal, that's like the answer to your questions.
The other hot topic that came up when we were asking questions is the new GLP-1 weight loss drugs. What are your thoughts on those, the usage? Do you see any after effects? Like, what are some of your thoughts?
I think it's still too new to look at all the pros and cons. I've, you know, if you read those disclaimers in terms of what the side effects can be, it's the worst of the worst that they list. But I think it's creating a false sense of security, and I guess I am of the mindset that there's not enough research out there to see what it's going to do. And, you know, we'll be 10 years down the road figuring out, oh, this was the result of this, and
Got
this,
it.
you know.
That makes sense.
And I absolutely agree with you 150%. I'm not that person, because I know when you go to the doctor and they have all these new samples, ooh, look what we got today. Here. And everybody gets it because that's the drug of the month. And seriously, and I kind of look at this as it's like an easy way. Some people have been struggling with weight their whole lives, and it is like a godsend to them. But if it hasn't been on the market 10, 20 years, I'm sorry, because you don't know outcomes. Look at some of the other drugs that we've taken, and then down the road, look at the adverse effects. That, you know, are they reversible? Are they curable? I want to see some history. I want to see, and I want to know what it has done and how it has affected Black people. I have many people that I know, nurses, friends, that are taking the injections, and the pounds are just dropping off. They look amazing. But I'm always like, especially when you're dealing with a medication that has to do with a disease process, and you don't have that disease process, but now you're doing something like kind of a treatment
To trick your body.
So what happens when you finish taking it? How long are you going to revert back to you getting the weight back? That would be devastating mentally, physically to you after, you know, the cost of it. But I'm more on safety and history and what they say the odds are, the percentages are. And when they have to put all of those adverse effects, you don't want to be that person or in that batch of folks that those things actually happen to. But I'm just naturally very like, I need proof, because they're making things now. And of course, it's selling off the markets. I mean, everybody's using it. But what is that going to do to you if you're not a diabetic? You know, your pancreas is not used to any changes or anything, and the way you metabolize your food and all of that, you have to think about there's a process that's going on in your body, and you've thrown it all off kilter. People seem to be doing well while they're on it. Again, I can't speak to what happens down the road, but I'm just that sinister person that I want proof. I want to know that we're gonna be okay.
And I find I have a hard time with the fact that a lot of our recommendations for medication are via television commercials.
That part,
And
yes.
so it's like you're watching your favorite show, and 5 times during the show, or you're seeing an advertisement for this drug or this drug, and it's like
in song.
Yes.
Yeah, in song.
Oh, there you go.
Yes. So it's like, and you know, and doctors find it frustrating too, because patients come in and, well, I saw this drug on TV, and it's like, well, okay, some doctors will write the script. No, you know, no question that you ask for that, they're going to give it to you. I say, but then they're not looking at some may not look at the fact of what your predisposing issues, medical issues are, or what your comorbidities, or what your family history is. So that may not be the drug of choice for you, but the commercial said, if I've got this, this, and this will work.
Yeah.
And like you said, don't be Dr. Internet. And that's the thing that we see at the hospital. So we're talking to our patients. Everyone has already, and I'm all about reading up on your disease process and being informed. So when the doctor talks to you, you're kind of like on the same page. Or you can, if you say something that sounds right, you go, oh, well, they've looked this up. And then you're going to have a more fulfilling interaction and sharing of information and questions answered. But don't let that be the driving force of what you, because if you notice how many people are out there on the internet giving you instruction and information about your disease process, you want to go to the official people to do that. And when we go into the doctor and we say, I saw this, I want it, like you said, and we can be very difficult because we saw this, we want it. But is it the best thing for us is the question. So dig deeper.
When you mentioned about certain things for African Americans, I remember I have asthma. And I remember when they came out with the drug Advair, and my doctor was like, oh my God, you're going to love this. This is made for African Americans. I said, no, give me the white people drug. I don't know what that is. I'm going to stay with my Ventolin. I'm not doing anything new. We're going to stay with what works. Ventilin's been around forever.
You tested this how long
you tested it? No, I'm going to stay with my Ventolin. I just thought I'd throw that in there. That was a memory.
But there are certain drugs that are out there on the market that are not good for us as African Americans. And unfortunately, some of the drugs that are out there are considered as the first line of treatment. So if you come in with high blood pressure, your doctor may automatically, right off the bat, write your prescription for X, Y, and Z. Well, X, Y, and Z can cause you pulmonary edema, which means that it makes it hard for you to breathe. And if you have a persistent cough, that's one of the factors that can be a sign that this medication is not for you. But the doctors will automatically go to that one drug first choice. And because I had the firsthand experience with my mother, and say she was given this medication, and literally she was coughing nonstop. And so when I went back with her to the doctor, I said, like, okay, you've got her on this, this, and this. And this is one of the side effects. And she's one of the people who reads that literature on the side effects and potential side effects of medication. So it was like, okay, she's having this. Is this not? He said, oh no, we need to take her off that right away. I'm like, why would you prescribe this to an African American person as a first drug of choice? Because there are plenty of others out there that will treat hypertension that are not considered as negative for us as a culture.
And it's so, Rhonda said, there's so many Black people who come into, minorities that come in, and a certain drug is actually black boxed for us. It's on the box. If you read it, that, it's not for us Black as a culture. But again, because that's the drug of the month, it just came out, and we're pushing that. The drug companies and all of that. Here's some free samples. You have to, that is such a poignant piece of knowing what you're taking, making that doctor tell you what you're taking, why you're taking it, and is this the best drug for me? Because then you need to, when you go pick it up, you're going to have that same conversation with your pharmacist. And when they say, you want to know about this? Yes, I do. I'm going to roll on over to that other window, and we're going to have a conversation. And please do that when you take a new drug, because they will tell you, because I've had doctors say, why are you taking that? Do you know you shouldn't take that? Yeah, I know what I'm taking. But so please be information, ask questions. I'm going to leave it right there.
Okay, so our next question comes up is, what is the difference for a colon guard versus a colonoscopy? And what age do you suggest people start getting?
Usually the colonoscopy is 45 and or 45 is usually considered as your baseline where you should have this initial screening. The Cologuard, I want to say the difference with the Cologuard because I'll be perfectly honest with you, I don't know the whole pros and cons of it, but I think what's attractive to that is there's not a lot of prep. And the reason why most people won't do a colonoscopy is because they know they have to do the bowel prep. And I don't care what the doctor tells you, there's no nice way to do it. And and to me, I find that you have a whole lot of prep for a few minutes.
Right.
And literally you go in, you have the colonoscopy, and by the time you wake up, it feels like it's 15, 20 minutes, you know?
Yeah.
But you take 2 days to prep for it.
Right.
You know?
Right. And you can't skip that. I had a friend who thought they were going to do half of what they said. And they're like, she checked in and they were like, nah, you didn't do this. Go back home and try again.
Now
So you can't cheat. Yeah, they got to start all over. So you can't cheat it either. They're not going to cheat and check.
Can I say something about the Cologuard?
Of course.
Okay, so it tells you that if you have any family history, you have any real signs and symptoms, you have that blood that the young lady was asking about, you don't want to use Cologuard. You need to take the prep and let them go in so that they can look and be, because colon cancer is a terrible thing. My mom had it, and she always had her colonoscopies. But the Cologuard is for people who are not symptomatic. They're just doing a check to make sure everything is okay. But if you have any idea that you have any adverse situation, symptoms, bleeding, any of that, you're going to bypass that. That's not for you. You need to have the doctor take the prep and go in and make sure they look. Every time that I've gone in, they've removed 6, 7, 8 polyps, and every time. And so you don't want the polyps can become cancerous. You need to have somebody go in there and look. And do I hate the prep? Yes. I've had taken half of the prep and then was sick and had to start a different kind of prep in the middle of it but it was I'm so happy that I did, because when they found all those polyps and my mom had colon cancer, that could have been life-threatening for me. So just like a quick test is not necessarily the best test.
Got it.
And sometimes you have to fight for your rights to have a colonoscopy.
You do.
Because what I've run into some situations that because insurance has the guidelines, 45 is considered as the screening age. If you are under 45, you will have a fight in order to get a colonoscopy done. So unless your doctor is definitely in your corner and will do the insurance battle, you're going to have to fight in order to get a colonoscopy if you're under 45.
Okay. Next question is one that all of us bear heavily: stress. What are some symptoms and what are the effects of stress? Because we keep moving, guilty as charged, and thinking that, you can just keep pushing through and that, you're just going to just keep going, even though you are carrying a lot. So what are some of the effects of doing that, of carrying the stress?
Well, I've lost my hair up here. And I think it can be manifested in physical symptoms. So like with the hair loss, I guess you could say you have the mood swings with the stress as well. Anxiety, you can have the depression, which goes back to the mental health issues. So it's kind of like hard to really focus on actual things, but it definitely impacts how you react and what you react to. So,
well, I'm going to say stress can kill you 100%. If you are predisposed to high blood pressure, remember that I always like your body's a circle. So if you have high blood pressure, then stress is going to add to that. You can end up with a stroke. because your blood pressure was high. You can end up with a heart attack because you were stressed and your blood pressure was high. And then what happens is when your blood pressure is high, that causes the vessels in your heart to constrict. So you're limiting blood flow to all your vital organs. So your brain's not being have enough circulation, and then you can get ulcers. It's going to go down to your stomach. Okay, then you can have bleeding ulcers. That's an emergency. Okay, it affects you tremendously. We can't say, oh, I'm just stressed, because if you can say you're stressed, you are, and you need to step back and look at and you have to try to work through it. Give yourself time away. Just take a moment to just walk outside. Anything, but most importantly, tell your doctor, because again, stress is going to drive that blood pressure. That's the driving force. And we as Black people know that we're 3 times more for heart attack and like I said, stroke. Again, the ulcers, but it's very detrimental. And even mentally, especially when you start with the headaches. When you start feeling you stressed and you start getting headaches, then it's time for you to talk to somebody, talk to your doctor. So you have to.
Quick question. So as far as the stress, what advice would you give? Because sometimes people think, oh, let me have a glass or other things to help calm me down. What would you advise to help with relieving stress? Is it walking, the type of foods we eat? What are some things that we can...
The dreaded E word, exercise, because that takes your mind off of everything, because you're so busy panting and blowing, trying to get through that exercise that, you feeling good, you ready to go to bed, take a nap, get a shower, it's all good. So that, that's number one. We don't want to do it, but it takes you away from everything. You're focused on, am I going to have enough oxygen to get back to the car? Really. But again, and I know you're talking about other things that people use. Sometimes we use alcohol. If you're going to do it, and I'm not purporting alcohol, I'm just saying wine, red wine. Okay, just a little hair, just something. I mean, if that's something that you just need, or anything to just, when you're that stressed out, you do need something to help you get to a level that you're coming out of it.
Because I heard chamomile tea helps with relieving stress.
Yes, I've used chamomile tea.
Anything without caffeine.
True, very true.
And wine helps. I'm not gonna lie. I'll be perfectly honest.
Everybody got reason, just one glass.
We didn't say a bottle.
Don't talk up the bottle. Share the bottle.
But you do have to find a mechanism to alleviate that stress. And one of the articles I heard was talking about, just find something that makes you laugh.
Yeah.
Call your mom, call somebody who wants to talk to you. Remove yourself from the situation that you're in right now that is stressing you out. That's the focus.
Find out what the stressor is.
Exactly.
Right.
But one thing doctors will give you medication. I mean, that's what they do. I think the more holistic things that we can do, safe things we can do, is a lot better, because then you don't want to become dependent upon those medications, because then that's how we end up with a lot of situations. Because, I took one yesterday and now I got to take 2 today because it's a really bad day. And then you end up, you're taking too many.
Yeah. So I think we're going to wrap up by asking about, to bring it all back to the first episode, how can we truly advocate for ourselves in terms of the health field when we see our doctors, just if it's a regular doctor's visit for a checkup? It doesn't even have to be at that emergency level. What are some of the maybe words or terminology that we use to really advocate for us?
I think number one is ask questions. Don't take everything at face value, because just because he said so or she said so doesn't necessarily mean it's so. Look at who you are and what's going on in your life at that time, and just kind of be your own advocate. That's probably the easiest way. but the hardest thing to do, because we have a tendency to accept what's going on and what the doctor says. Or like I said, when you go in to see the doctor and he asks you how you're doing, I'm fine. Well, no, you're not. Life is getting the best of you. Your kids are all growing up and you're getting into the empty nest syndrome. You're now the caretaker of your parents because that's becoming a new issue. You're the caretaker or the caregiver for your spouse. So you have to admit what's going on in your life at any given time or at the time and look at it realistically. And you're not a whiner if you state this is what's going on.
That part.
So it's just kind of like, just say it. So.
Well, you went to the doctor because you didn't feel good. You're not going to tell me that I have symptoms that are making me so uncomfortable or in so much pain or so much distress that I'm okay. And if you are a doctor and you tell me we're going to watch it, no, you're not. Speak up for yourself. You are your best advocate. We have so few doctors left, and they are being pressed so hard, and they're being given time frames that they can see patients within. Healthcare is not our grandmother's healthcare anymore. And it is easy to say, well, you look good, your vital signs are stable, and we just gonna watch it. No, you're not. Because that's your right to say, I want to know what you think. Need you to write that down, make sure I'm understanding it. And one thing that people don't understand, you have a right to get a second opinion.
Absolutely.
I am the queen of second opinions because I know how I feel. And the one thing you can do is demean me to try to tell me that I don't feel like I feel. And being a nurse, you can't tell me that. Because I wouldn't have never taken on my day off, come here to see you to just chit chat. Right. I'm sick. Believe in me, trust me, treat me. So I believe that is what we have to do, is to advocate for yourself. Again, don't be afraid to state, I don't agree with that. Some people are like, well, okay, doctor, yes, doctor. No, I don't agree with that. That's not really how I feel. Let me tell you again how I feel, and have them explain to you why they feel it's okay. Don't feel like you can't ask them, well, I would like to have this test done. So at this point, I am going to say, if you want to talk to, a friend or family, or go on the internet and just kind of look up your symptoms, so that when you go in there, you're knowledgeable as to what just might be maybe the issue, so you can stay on the same path. Don't go down the path of, we're going to check you later, we're going to watch it. Or the next path is you're going to come in and we may not be able to treat this. You know your body. It will talk to you until it doesn't. And at that point, you don't want to get to that point, because we want to be able to save you. And we can save you early stages and things, regardless of what the situation may be. But you must advocate for yourself and your parents and your children. Because we don't have the physicians that we had. They don't have the time frames they'd have had. Everything is like a rat race. And one thing I always tell them, do not let me see on my chart that you said that, like how they treat all women, like, oh, it's just stress and it's hormonal and it's whatever. No. I don't want to see that on my chart. Don't want to see that ever. Because I'm not a person that comes to the doctor. If I'm like, when I'm really, really, really ill, and I call them, they tell me come in because they know it's something really wrong with me. Be that way about yourself. You know your body better than anybody. God is going to send you on a path that tells you, okay, here's my first clue that something's going wrong. Then I'm going to send you another clue. You don't want him to set you down, because that will be the last clue. And I've been there. God, she would tell you, he has sat me down because I didn't listen to my body, because your body speaks to you and you know it. Am I telling you, does your body not speak to you? Do you know when you're really sick? And when you're like, I can take a nap, take a couple of Tylenol. Okay, and that's me. I'm terrible. But when I'm ill, I know it. Act on it. Act on it, because that's God sending angels, to lift you up and get you in your car and take you to that doctor to save you. Because we can save you in early stages, not necessarily down the road. And we don't want to, and as women, what we do is we're so busy taking care of everyone else in school and all this stuff with the children, we put ourselves last. Mm-hmm. You have to put yourself first, because you can't continue to take care of everybody if you're not taking care of yourself.
Well, I think that's a very powerful message, and that's part of what we, Grace Over Grit and Growth, we have to have self-care. Self-care is not being selfish.
No, it's not.
Right,
No,
and
it's
it's not just for you. So always remember that. So we would like to thank you, Pat
Thank you for
and
having
Rhonda,
us.
for being here with us.
Thank you.
We
Thank
hope,
you, audience.
we want to thank the audience. We hope that you heard something today that touched you, that you know, will help you be an advocate for yourself, for your parents, for your children, to make, you know, our lives better.
Yes.
So, so where can they find us? This is how we always do this.
You didn't have a pleasure of being with us live today. You can still check us out. You can find us on YouTube, Instagram, and Facebook.